Hi everyone, I'm Jun. I'm representing the sleep research team. This is our sleep research team. We have a very strong team here with three principal investigators, including Professor Albert Lee, who is the chairman of this department. We have Dr. Kate Chen, who is one of the clinical professional consultant, and myself. I'm a research assistant professor. And our research interests mainly focus on childhood sleep disorder briefing, from simple snoring to the more severe form of obstructive sleep apnea. And we have also done some work on sleep deprivation, which is an extremely common problem, especially in adolescent age group. And we are particularly interested in looking into the cardiovascular outcome of this sleep disorder. And the assessment tools we usually use in our sleep research includes polysomnography, which is the overnight sleep study to assess the severity of sleep disorder briefing, and also actigraphy, which is a method to evaluate, to monitor the sleep work pattern of an individual. So what have we done so far on childhood sleep disorder briefing? First of all, we have conducted a community-based, large-scale community-based epidemiological study to evaluate the prevalence and risk factor of habitual snoring and also obstructive sleep apnea in Hong Kong primary school children. And from that study, we have also established a very good cohort that have been being followed up for many years. And for complication, we have conducted several observations to investigate the neurocognitive and cardiovascular outcomes of sleep disorder briefing. And regarding treatment, we have conducted a number of randomized control trials to evaluate the effectiveness of various treatment options for children with OSA. And for diagnosis, we have tried to identify novel anatomical markers trying to help with the diagnosis. And for natural history, we also have conducted several long-term and longitudinal studies to evaluate the natural progression of OSA from childhood to adulthood. So what are we currently pursuing on the topic of sleep disorder briefing? First of all, we have just secured funding to conduct another long-term follow-up study on the community-based cohort, which was established 18 years ago. And for diagnosis, we are continuously trying to identify novel anatomical marker with various imaging techniques, including ultrasound, X-ray, and MRI. And we are establishing prediction model trying to predict the presence of OSA in children. And we are also exploring to use photogrammetry and face shape analysis to screen for children who are at risk of OSA. And for complications, we are exploring various forms of cardiovascular outcomes in children with OSA, and we are now investigating the long-term cardiovascular outcome of children who had received surgical treatment years ago. And we are also conducting observational study to investigate the association between childhood OSA and retinal neuronal structure and vasculature. And for treatment, we are conducting randomized control trial to evaluate the effect of surgical intervention on cardiovascular outcomes. And we are also conducting another randomized control study to evaluate the effectiveness of some new novel treatment options like high-flow nasal cannula, which is a new generation of mechanical ventilation for the treatment of OSA. And for precision medicine, we are trying to identify OSA subtypes by cluster analysis using our existing data. And we are also trying to identify predictors of long-term outcomes and treatment responses by evaluating the endotypes, that is the intermediate phenotypes of childhood OSA. And regarding sleep deprivation, we have previously found that short sleep duration is associated with elevated blood pressure in adolescents. So we are now conducting an observational study to investigate the potential effect of sleep extension. So to see whether sleeping longer will have to reduce the blood pressure level in sleep-deprived adolescents. And we also found that sleep insufficiency is a very common problem in preschool children. And the increase in screen time is a very important contributor. And so we are now conducting sleep education workshop for parents of preschool children with insufficient sleep, trying to improve their sleep. So what sort of trainings will you receive if you join our department? I think first of all, no matter which supervisor you choose, you will learn how to conduct the research study properly. So you will have to learn how to identify an important research question, how to establish a good hypothesis, and then how to answer research question, and how to test your hypothesis with a proper study design, with a proper way to plan your investigation with appropriate statistical analysis. So if you join our sleep team, you will learn skills that is specific to sleep research, including knowledges of various sleep disorder, and you will learn how to carry out polysomnography, that is sleep study for the diagnosis of sleep disorder breathing. You'll learn how to process the physiological signals, how to analyze those physiological signals, and you'll learn how to carry out actigraphy for the sleep pattern monitoring, and you also learn how to conduct some simple neurocognitive tests or cardiovascular assessment, and how to analyze the data such as blood pressure data and heart rate variability data. So you may ask, can I be a sleep researcher? And my simple answer to you is a definite yes, if you have the passion and if you want to learn more about sleep. And sleep is considered, actually, it can affect many different aspects of our life, and it can be affected by many different aspects of our life. So sleep is a research topic that is usually considered to be multidisciplinary, which may involve doctors from different specialties. It can involve clinical psychologists. It can involve medical engineers, epidemiologists, data scientists, basic scientists, and also sleep technologists. Even if you currently do not belong to any of these categories, you may still develop yourself to be one of these within your study period with us. So if you are interested in doing pediatric sleep research, or if you have any question related to our sleep research, please email any of us, and we will get back to you as soon as possible. Thank you.